Thank you for joining the American Association of Kidney Patients for today's session on I Am a Kidney Voter, Voice and Impact for 2020. My name is Diana Clynes. I'm Executive Director for AAKP. Today, I am pleased to introduce my fellow colleague, Erin, Director of Stakeholder Operations for the Center for Patient Engagement and Advocacy. AAKP is a nonpartisan, nonprofit organization that has a 50-year history of policy achievements on behalf of patients. One of our founding members dialyzed in front of Congress in 1972, which led to the creation of the modern ESRD program, or Modern Dialysis and Transplant Coverage. The ESRD program remains the only disease-specific entitlement program in America and has saved over 1 million lives. AAKP maintains an extensive network of bipartisan relationships and believes kidney disease is a threat that unites all Americans and should never become an obstacle for an individual to achieve their aspirations. AAKP created the Center for Patient Engagement and Advocacy in 2014 to leverage AAKP's increasing national influence and to advance our strategy for full patient care choice within the national public policy process. We made a firm commitment in 2014 to fellow patients that we would raise their independent voice in every important policy discussion that could impact their future care choices as health consumers. The Center for Patient Engagement and Advocacy allows us to do exactly this under one roof. Within the center, AAKP coordinates efforts to build patient and care partner membership, expand our extensive and unique data analytics, and target AAKP patient engagement and advocacy initiatives via grassroots mobilization, social media, and national media. Additionally, as part of the AAKP national strategy, the Center for Patient Engagement and Advocacy also works to engage, train, and deploy kidney patients, living donors, and care partners in ways that are the most effective. This includes critical times when national legislation, health program implementation, or regulations pose a threat to the rights of kidney patients under the Americans with Disabilities Act or to the right to care choice as patient consumers. We also engage our patients to support key initiatives and innovation, including the Kidney Precision Medicine Project, or KPMP, the Kidney Health Initiative, or KHI, and other programs like KidneyX. In 2018, AAKP launched the largest voter registration campaign in the kidney community. We did this in part to remind Congress and appointed officials that kidney patients are an important segment of their constituency and that kidney patients can and will hold them accountable for policies that negatively impact patient care choice and access to medical innovation. At the time, AAKP was in opposition to the Dialysis Patient Demonstration Act, legislation that would have limited both patient care choice and patient access to kidney transplantation. While kidney patients do not have the wealth of lobbyists, they do have a vote, and they will exercise it when their care is threatened. Titled, I Am a Kidney Voter, this campaign has increased voter registration among kidney patients, family members, and care partners across all 50 states. AAKP believes it is vitally important that every patient understand the importance of their vote and to educate themselves on where their elected leaders stand on the future of kidney care. I am pleased to now turn it over to my colleague, Erin, who oversees the I Am a Kidney Voter campaign. She will provide a tutorial on the AAKP Action Center and how you can become a kidney voter. Erin, please go ahead.
Thank you, Diana. I'd like to take a few minutes to share with you how your vote and voice can have an impact in 2020 and beyond. With the AAKP Action Center, you can make sure your vote counts and your voice is heard. You can share your personal story as it relates to kidney disease, dialysis, transplant, or as a living kidney donor. You can help to make kidney disease a global priority in the eyes of lawmakers and public servants. And you can contact your elected officials and take the letters we have drafted for you and personalize them with your story, aspirations, and goals as someone impacted by kidney disease. You can access our Action Center from our homepage, aakp.org, by hovering your mouse over the Center for Patient Engagement and Advocacy heading and clicking on Action Center. I have also included a direct link on this slide. From the Action Center, you can register to vote, or you can take action on a specific legislative issue by personalizing a letter to your U.S. senators, U.S. representative, and other elected leaders. In 2018, AAKP created the first ever Kidney Community Voter Registration Drive. We have increased our impact over the years, and since our launch and labeling of kidney voters, our impact has accelerated. Elected leaders are now interacting with both a patient community and an informed, well-organized voting constituency in every state. This has not been done before in the kidney community, but has had great success in other patient communities like HIV and breast cancer. We encourage you to follow us on social media and participate in the kidney voter campaigns we hold year-round and on important days like Election Day. It is easier than ever to become a kidney voter. You can register right in our Action Center. Enter your mailing address and you will be directed to information about voting in your state. It is very important to remind your elected leaders in both parties that you are a voter who is managing kidney disease, or that you're a family member or have a loved one of someone who is managing kidney disease. This adds a new element and a reminder of your importance to the discussion. AAKP is nonpartisan, meaning we never tell patients, caregivers, or medical professionals how to vote, but we do encourage everyone to register to vote. Research each candidate and ask elected leaders about their positions on issues like innovation, new biologics, devices, and diagnostics. Make sure they understand the challenges of living with kidney disease and what you would like to see changed. We hope you will be part of AAKP's Action Center if you are not already. Your voice will be heard, and we will change the status quo and make improvements in care and treatment of kidney patients. Please check out the September 2019 issue of our Renal Life magazine to learn more about becoming a kidney voter, and you can also read a blog post on our website from a member of the AAKP Board of Directors and Ambassador, Dale Rogers, on why he is a kidney voter. Become a kidney voter and use your voice to inform how kidney patients are cared for. Thank you for your time today.
Thank you, Erin, for an excellent presentation and constructive guidance on how individuals can register to vote through AAKP, utilize the AAKP Action Center to remain up to date on current and emerging legislative issues impacting their care, and how to make their voice heard throughout the halls of Congress. We appreciate it, Erin. Thank you.